let's address one of the most important yet rarely discussed aspects of healthy aging: intimacy and sexual wellness after 60. If you've ever wondered whether your interest in physical intimacy is normal for your age, or if you've felt pressure to either maintain or abandon sexual activity based on what you think is expected at your stage of life, this conversation is long overdue. What you're about to learn might surprise you and could significantly improve both your physical health and emotional well-being. Geriatricians and sexologists who specialize in aging have spent decades studying how sexual health affects overall wellness in older adults, and their findings challenge many of the myths and assumptions our society holds about aging and intimacy. Dr. Eli Coleman, a renowned sexologist and professor at the University of Minnesota, explains that sexual health is an integral component of overall health throughout the entire lifespan, not something that diminishes in importance as we age. The research is clear. There is no magical age when sexual interest or activity should stop, and there's no normal frequency that applies to everyone. What matters most is what feels right for you and your partner, if you have one, while ensuring that intimacy remains safe, comfortable, and consensual. The key is understanding how aging affects your body and adjusting your expectations and approaches accordingly, rather than abandoning this important aspect of human wellness entirely. Before we dive into what science tells us about healthy sexual frequency for older adults, it's crucial to understand that this conversation is about much more than just physical activity. Intimacy encompasses emotional connection, physical affection, touching, and yes, sexual activity when desired and appropriate. All of these elements contribute to what researchers call sexual wellness, a state of physical, emotional, and social well-being related to sexuality. The first thing that medical researchers want older adults to understand is that sexual interest and capacity don't disappear at 60, 70, or even 80. The National Poll on Healthy Aging, conducted by the University of Michigan, found that among adults aged 65-80, 40% reported being sexually active, and among those with partners, that number jumped to 54%. What's more important is that those who remained sexually active reported higher levels of life satisfaction and better overall health. Dr. Linda Waite, a sociologist at the University of Chicago, who has conducted extensive research on sexuality and aging, found that people who maintain active sex lives as they age experience numerous health benefits. These include better cardiovascular health, improved immune function, reduced stress hormones, better sleep quality, and enhanced mood regulation. The physical and emotional benefits of intimacy don't diminish with age. In fact, they may become even more important for overall well-being. However, it's essential to understand that being sexually active doesn't mean adhering to the same patterns or frequencies that might have existed in younger years. Sexologists who work with older adults emphasize that sexual wellness in later life is about quality rather than quantity, and about adapting to the natural changes that occur with aging, rather than fighting against them. The second crucial point that sex therapy specialists make is that aging affects men and women differently, and these changes are completely normal and manageable. For women, the hormonal changes that occur during and after menopause can affect vaginal lubrication, tissue elasticity, and sometimes libido. For men, erectile function may change, and the time needed for arousal and recovery between sexual encounters typically increases. Dr. Barry Komisaruk, a neuroscientist at Rutgers University who studies sexual response, explains that these changes don't mean sexual pleasure decreases with age. In fact, many older adults report that their sexual experiences become more satisfying because they're less focused on performance and more focused on intimacy, emotional connection, and mutual pleasure. The pressure and anxieties that often accompany sexuality in younger years frequently diminish, allowing for more relaxed and enjoyable experiences. Medical professionals emphasize that the key to maintaining sexual wellness as you age is adaptation and communication. This might mean using lubricants to address dryness, taking more time for arousal, exploring different positions that are more comfortable, or expanding your definition of sexual activity to include more touching, kissing, and other forms of physical intimacy that don't necessarily involve intercourse. The third important finding from sexual health research is that frequency is far less important than satisfaction and emotional connection. Studies conducted by the American Association of Retired Persons found that older adults who reported satisfying sex lives weren't necessarily having sex more often than those who reported less satisfaction. Instead, they were more likely to communicate openly with their partners, take time to address physical changes, and focus on mutual pleasure rather than performance. Sex therapists who specialize in working with older couples often observe that many people become better lovers as they age because they've learned to prioritize their partner's needs, communicate more effectively, and let go of unrealistic expectations based on media portrayals of sexuality. The wisdom and emotional maturity that come with age can actually enhance sexual experiences, even as the physical aspects may require some adjustments. For those who are single or not currently in relationships, sexual wellness can still be an important part of overall health. Self-pleasure is a normal and healthy aspect of sexuality throughout the lifespan, and it can provide many of the same physical and emotional benefits as partnered sexual activity. Healthcare providers who work with older adults emphasize that masturbation is safe, normal, and beneficial for people of all ages, including seniors. The fourth key insight from sexual health research is that certain health conditions and medications can affect sexual function, but most of these issues can be managed with proper medical care and communication with healthcare providers. Conditions like diabetes, heart disease, arthritis, and depression can all impact sexual interest or function, but they don't necessarily mean the end of sexual activity. Geriatricians who specialize in sexual health note that many older adults unnecessarily give up on sexual activity because they assume their health conditions make it impossible or unsafe. In reality, most health conditions can be managed in ways that allow for continued sexual wellness. The key is having honest conversations with healthcare providers about sexual health concerns and working together to find solutions. For example, people with heart conditions often worry that sexual activity might be dangerous, but cardiologists explain that for most people, the physical exertion involved in sexual activity is equivalent to climbing 2 flights of stairs or taking a brisk walk. If you can engage in those activities safely, you can likely engage in sexual activity safely as well. However, it's always important to discuss this with your healthcare provider, especially if you have heart disease or other serious health conditions. Similarly, medications like antidepressants, blood pressure medications, and others can sometimes affect libido or sexual function. Rather than simply accepting these side effects, it's worth discussing alternatives with your doctor. Often medication adjustments or timing changes can minimize sexual side effects while still providing the health benefits you need. The fifth crucial finding from research on aging and sexuality is that emotional and psychological factors often play a larger role in sexual satisfaction than physical factors. Psychologists who study sexuality in older adults have found that self-esteem, body image, relationship quality, and communication skills are often more predictive of sexual satisfaction than physical health or function. Many older adults struggle with body image concerns as their bodies change with age, and these concerns can significantly impact sexual confidence and enjoyment. Sex therapists emphasize that learning to appreciate your body for what it can do, rather than focusing on how it looks or how it's changed, can be transformative for sexual wellness. Dr. Peggy Kleinplatz, a clinical psychologist and sex therapist who has studied optimal sexual experiences across the lifespan, found that older adults are actually more likely than younger people to report having the best sex of their lives. Her research suggests that this is because older adults are more likely to prioritize emotional connection, take time to communicate their needs, and focus on pleasure rather than performance. Now let's address the specific question that many older adults have but rarely feel comfortable asking. How often should you be having sex? The answer from sexual health researchers is both simple and complex. There is no universal should when it comes to sexual frequency at any age, but especially not after 60. What matters is finding a rhythm that works for you and your circumstances while maintaining your overall health and well-being. Dr. Meredith Small, an anthropologist who studies human sexuality across cultures and ages, explains that the concept of normal sexual frequency is largely a cultural construct that doesn't reflect the enormous individual variation in human sexual desire and expression. Some people are naturally more interested in frequent sexual activity, while others prefer less frequent, but perhaps more intense intimate experiences. Both patterns are completely normal and healthy. Sexual health specialists who work with older adults report that their patients often express relief when they learn that there's no frequency standard they need to meet. Many older adults have been carrying anxiety about not being sexual enough, based on unrealistic expectations often derived from media portrayals or memories of their younger selves. This anxiety can actually interfere with sexual enjoyment and create a cycle of avoidance that serves no one. Well, the research suggests that what's most important is listening to your own body and desires while maintaining open communication with your partner, if you have one. Some older couples find that they prefer sexual intimacy once a week, others once a month, and still others prefer more or less frequent encounters. What matters is that both partners feel satisfied with the level of intimacy in their relationship, and that no one feels pressured or neglected. For single older adults, the same principle applies. Some people choose to pursue new romantic and sexual relationships. Others prefer self-pleasure, and still others decide that sexual activity is no longer a priority for them. All of these choices are valid, and sexual health experts emphasize that there's no right or wrong decision as long as it aligns with your personal values and doesn't cause distress. However, geriatricians and sex therapists do offer some general guidance based on the physical and emotional benefits of regular intimacy. Research suggests that some form of sexual activity, whether with a partner or alone, on a regular basis can help maintain sexual function, reduce stress, improve sleep, and support overall emotional well-being. This doesn't necessarily mean intercourse. It can include any form of sexual expression that feels good and satisfying to you. Dr. Helen Fisher, an anthropologist who studies love and attachment, notes that regular physical intimacy helps maintain the production of hormones like oxytocin and endorphins that contribute to bonding, mood regulation, and stress relief. These benefits don't require any specific frequency, but they do suggest that completely abandoning sexual activity might mean missing out on important health benefits. That said, sexual health experts are clear that no one should feel obligated to maintain sexual activity if it's no longer pleasurable, comfortable, or desired. Some people naturally experience a decline in sexual interest as they age, and this can be perfectly normal and healthy. The key is distinguishing between a natural decrease in interest and problems that might be addressed with medical care, communication, or other interventions. Safety considerations become increasingly important as we age, and sexual health specialists have specific recommendations for older adults who want to maintain active sex lives. First and foremost, sexually transmitted infections don't discriminate by age, And older adults who are dating or have new partners need to practice safe sex just as much as younger people do. In fact, STI rates among older adults have been increasing in recent years, partly because this generation didn't grow up with comprehensive safe sex education. Healthcare providers emphasize that condoms and other barrier methods remain important for older adults, and that regular STI testing should be part of routine healthcare for sexually active seniors. This is especially important because some STIs can be more serious for older adults whose immune systems may not be as robust as they once were. Physical safety is another important consideration. Geriatricians recommend that older adults pay attention to physical limitations and adapt their sexual activities accordingly. This might mean choosing positions that don't strain arthritic joints, taking more time for arousal and preparation, or using pillows and other supports to ensure comfort. The goal is pleasure and connection, not athletic performance. So there's no shame in making modifications that enhance comfort and safety. For people taking medications, it's important to be aware of how different drugs might affect sexual function or interact with any treatments you might be using for sexual health. For example, if you're using medications for erectile dysfunction, certain heart medications can interact dangerously with them. Always discuss sexual health with your healthcare provider to ensure that your intimate life doesn't conflict with your other health needs. Lubrication becomes particularly important for older adults, especially women who may experience vaginal dryness due to hormonal changes. Sexual health specialists recommend high-quality, long-lasting lubricants and emphasize that using them isn't a sign of inadequacy, but rather a smart adaptation to normal bodily changes. Many couples find that incorporating lubricant used into their intimate routine actually enhances rather than detracts from their sexual experiences. Communication becomes even more crucial as we age and our bodies and desires change. Sex therapists who work with older couples often focus heavily on helping partners talk openly about their needs, concerns, and preferences. This might include discussing physical limitations, expressing interest in trying new things, or negotiating different levels of sexual interest within a relationship. Many older adults find that they become better at sexual communication as they age because they've learned the value of honesty and have less ego invested in sexual performance. This can lead to more satisfying sexual experiences, even if they're different from what they experienced in younger years. For those who are experiencing challenges with sexual function, modern medicine offers more options than ever before. Treatments for erectile dysfunction, vaginal dryness, low libido, and other common age-related sexual health issues are widely available and generally safe for older adults when properly supervised by healthcare providers. However, sexual health experts emphasize that medical interventions aren't always necessary or desirable. Sometimes simple changes in approach, timing, or technique can make a significant difference. Taking more time for arousal, focusing on emotional connection, exploring different types of touch, or scheduling intimate time when energy levels are highest can all enhance sexual experiences without requiring medical intervention. Mental health plays a crucial role in sexual wellness for older adults. Depression, anxiety, grief, and other psychological factors can significantly impact sexual interest and function. Psychologists who specialize in aging emphasize that addressing mental health concerns often leads to improvements in sexual satisfaction as well as overall quality of life. For people who have lost long-term partners, the journey back to sexual wellness can be particularly complex. Grief counselors and sex therapists note that there's no timeline for when or whether someone should pursue new romantic or sexual relationships after loss. Some people find that new relationships help them heal and grow, while others prefer to focus on other aspects of life and well-being. The most important message from sexual health research is that aging doesn't mean the end of intimacy, pleasure, or sexual expression. While your sexual life may look different at 70 than it did at 30, different doesn't mean worse or less valuable. Many older adults report that their sexual experiences become more meaningful, more emotionally connected, and more satisfying as they age, even if they're less frequent or physically different than before. Practical steps for maintaining sexual wellness as you age include staying physically active to maintain stamina and flexibility, eating a healthy diet that supports cardiovascular health, managing stress through relaxation techniques or counseling, maintaining good communication with partners, and staying open to adapting your sexual practices as your body and circumstances change. Most importantly, don't let shame, embarrassment, or ageist assumptions prevent you from seeking help if you're experiencing sexual health concerns. Healthcare providers, sex therapists, and counselors are trained to address these issues with sensitivity and professionalism, and they understand that sexual wellness remains important throughout the lifespan. Regular checkups with healthcare providers should include discussions about sexual health, just as they include discussions about heart health, bone health, and other aspects of wellness. Many older adults are surprised to learn that their doctors are comfortable and knowledgeable about sexual health issues and can provide valuable guidance and treatment options. Remember that sexual wellness is a component of overall wellness, not a luxury or something that becomes inappropriate with age. You deserve to experience pleasure, intimacy, and connection throughout your life if you choose to do so. The key is approaching sexual health with the same care and attention you give to other aspects of your well-being, seeking appropriate medical care when needed, communicating openly with partners, and making choices that align with your values and desires. The research is clear. There's no expiration date on sexuality, and there's no standard frequency that everyone should aim for. What matters is finding an approach to intimacy that supports your physical health, emotional well-being, and overall quality of life. Whether that means active sexual relationships, occasional intimate encounters, solo sexual experiences, or choosing to focus on non-sexual forms of intimacy, the choice is yours to make based on what feels right for your life and circumstances. Your sexual health matters because you matter. Your pleasure matters because your well-being matters. And your choices about intimacy deserve respect and support, regardless of your age. Don't let anyone, including yourself, tell you that you're too old for physical pleasure, emotional connection, or sexual expression if these are things you value and desire. If this information has helped you think differently about sexual wellness and aging, please give this video a thumbs up and subscribe for more content that addresses the real health and wellness needs of older adults with honesty and respect. What aspects of sexual health and aging would you like to see discussed more openly? Have you found that your approach to intimacy has changed as you've aged, and if so, how? Share your thoughts in the comments. Your insights could help other viewers who are navigating similar questions about sexual wellness as they age, and if you're interested in more content about maintaining vitality and wellness throughout the aging process, be sure to check out our video about the surprising health benefits of staying socially connected as you age. Your well-being, in all its aspects, deserves attention and care at every stage of life.